Okay.
Yes, yes.
So good evening again, all the speakers and our online viewers. I feel very delighted to introduce Manav Zameen Foundation to all of you on the first webinar rather of Manav Zameen Foundation. Manav Zameen Foundation is an integral part of Psycomm Education Pvt Limited, which was formed in the year 2012. Manav Zameen Foundation is rooted in a single ideology, maintaining wellness of mental health for every segment of the contemporary society. Whether it is your regular general well-being, your education, studies, your domestic environment, working or professional environment, we are there with you. We vow to lend our hands in every dimension possible for mental welfare of all the people, regardless of age, gender, social strata, and profession. To sum up in a phrase, I can say we keep our vision to address the varied psychosocial issues of the contemporary life. Manav Zameen Foundation has a distinct wing for the special children and students, learning disabilities for the psychometric assessments, and learning support, therapy, and other related interventions. Our major services include identifying, testing, and addressing mental health issues, wellness programs and workshops, providing creative therapies like art therapy, movement therapy, play therapy, music therapy, and so on. Alternative Education Institute for Special Children, which would definitely be a post-COVID endeavor. Let me now introduce you to all the members of the Manav Zameen Foundation team. Dr. Subarna Sen. She's a well-known face to many of you in Kolkata. By profession, a consulting psychologist, a faculty in the Department of Human Resource, Communication and Psychology, and a trainer of life skills. The key element of her today's introduction is that she is one of the founder directors of both Psycomm Education Pvt Limited and Manav Zameen Foundation. Ms. Atri Chakraborty is a practicing psychologist and visiting faculty and is the head of the Psychometric Assessment Department at Manav Zameen Foundation. Ms. Onoma Modok is the coordinator of research and training at Manav Zameen Foundation. She is a psychologist and telecounselor. Mr. Dipankar Sen was a sales and marketing professional at renowned corporate houses and is the head of communication outreach at Manav Zameen Foundation. Ms. Ornisha Sen is a sociologist by profession and has worked in well-known social sector organizations. He is the head of social outreach department of Manav Zameen Foundation. We look forward to your support in our journey and would appreciate a feedback or a word from your end in our Facebook page. Thank you and have a good time with us today.
Thank you, ma'am. Now, I would request Ms. Onoma Modo to take it forward from here.
Good evening, everyone. With over 300 million experiencing depression worldwide, it is one of the most common mental health conditions that exists. Depression affects people of all ages, ethnicity, race, gender, and income levels. Yet, depression can look very different depending on age and other factors. Knowing how to recognize depression symptoms is an important first step toward finding help when you or someone you care about is struggling. So, here, under the umbrella of Manav Zameen Foundation, we take the initiative to introduce our eminent speakers about their perception on depression. It's okay to be not okay, our today's topic. So, we welcome our first delegate today, Dr. Rima Mukherjee. Dr. Mukherjee passed her MBBS from Neel Ratan Sarkar Medical College and DPM from Kolkata University, where she ranked first. She is one of the first women psychiatrists in India to complete MRC Psychiatry from the Royal College of Psychiatrists, London. She used her expertise to set up Crystal Minds in South Kolkata. Dr. Mukherjee has worked in various premier hospitals of Kolkata, such as CMRI, AMRI Hospital, etc., and is currently working as a visiting consultant in Woodlands Hospital. She is an empaneled psychiatrist with the American Consulate. She is involved in the All Bengal Women's Union. She has been facilitated by various organizations and groups, including the Federation of Indian Chamber of Commerce and Industries, and many more, as a woman achiever. Techno India University and Brainware University for her outstanding contribution in the field of psychiatry and well-being. Dr. Mukherjee has won several laurels to her name. Welcome, ma'am. The dais is all yours.
Thank you. Thank you for inviting me in this platform. And I mean, am I supposed to start speaking right now, or you'll be introducing the other speakers?
No, ma'am. You may start speaking one by one. I would like to introduce them.
Okay. I think this is a very interesting topic, that it's okay to be not okay. First of all, there are certain, we have certain notions that we have to be happy all the time, we have to be fulfilled all the time and satisfied all the time, no matter what. I feel that that is a very inappropriate response to certain situations in life where you're not expected to be happy. So if somebody has died in your household, are you supposed to be happy? Are you supposed to be okay? If you're going through a crisis in your relationships, if you failed in your exam, or if you've become unemployed, or you have not been able to fulfill your own expectations, or we all have a plan that we want to do certain things in life. For some reason, if that doesn't work, we can feel upset, and it's all right to feel upset then, and it is even appropriate. With this, keeping this in mind, we also need to understand a few very simple, basic things. And that is that everybody is very unique and their journey in life is very unique. But society and the world at large has certain little tick boxes where you have to put ticks in those boxes, and that's when the world will recognize or appreciate you as being an achiever or as being a winner. Otherwise, even if you are quite happy doing something that did not fit into that tick box, there are others who are going to feel that you're not supposed to be okay. And conversely, if you've got ticks in all those boxes, you cannot be unhappy. Recently, there continues to be prolonged discussions about the young actor who died. And initially, after he committed suicide, there were questions that journalists asked his parents, that why did he die? He had everything. He had wealth, he had education, he came from a good family, etc., etc. So whatever tick boxes that the people think that is supposed to make us happy, he had all those things, yet he wanted to die. So this is something that a lot of people cannot understand, as to why somebody can feel bad having achieved those things. So first of all, that if that was the case, then there wouldn't have been then people in the West who have got a certain amount of money, or who had jobs at least prior to this COVID, or who were allowed to get out of a bad relationship and society didn't have much to say, or who were able to live life on their terms, on their own terms, were given permission to live life on their own terms, then they shouldn't be depressed and they shouldn't feel not okay, etc. So I think that it is time we got out of this mindset and accepted that yes, there will be times in our lives when we are not going to feel okay. And I think that not feeling okay, feeling sad, feeling angry, feeling hurt, feeling anxious, feeling depressed, all this is okay. A lot of the times this is appropriate. I find that as soon as I have a serious picture posted on Facebook, people ask me, why so serious? My question is, why do I have to laugh all the time? I mean, why is there a pressure? I mean, I'm a mental health professional, but nowhere have I undertaken any kind of understanding with anybody in this world, or neither have I signed any contract that I am going to have a smiling face all the time, come what may. খিলখিল করে আমি হাসবো কেন, মানে কারণ নেই অকারণে আমি ভীষণ ভালো আছি, আমি আনন্দে থাকি। Another thing that people say, ভালো থাকবেন কিন্তু আনন্দে থাকুন, কি করে থাকবো? I asked one of them, I recently asked them, আমি তো আমার মতো চেষ্টা করছি, but can you tell me ভালো কি করে থাকবো কিংবা আনন্দে কি করে থাকবো? That person got very taken aback. Then I get phone calls, you have to, because we are doing online sessions, so and because there is a mental health pandemic, so we are and there is a imbalance in supply and demand of mental health professionals, so it is expected that mental health professionals can be contacted morning, night, noon, whenever, whatever be the situation, whenever be the situation, you need to say that I am very depressed, or my mother is very depressed. It will be very convenient if you see that person right now, because right now, even if I'm not in a chamber, I can just go online and I can see the patient. So recently I got a phone call saying যে আপনাকে আমার মাকে এক্ষুনি দেখতে হবে কারণ আমার মা ভীষণ ডিপ্রেসড। আমি বললাম যে আমি ওনার থেকেও বেশি ডিপ্রেসড বলে আমি ফোনটা রেখে দিলাম। My point is যে again there are certain assumptions that people who are we have all the answers, we know all the tricks of the trade, so we can be happy all the time. Believe me, we are just as fragile as the rest of the world, and I think mental health professionals also need to look after themselves, and they need to come out of their feeling that they have to be all right, they have to be okay all the time, and they have to put on this this appearance of being well all the time. I think we too need to say in public that no, we are not all right. So coming back to it's okay, when is it? So we are talking about feeling moody, feeling sad, feeling angry, irritable, snapping at people. We are saying that up to a point it is okay. It is not okay when this continues to be for a very long time, when the depression persists for a long time, where it is affecting your normal day-to-day life, where it is affecting the way you have started perceiving everything around you. If everything is very negative, if everything is very bleak, and if you feel that life is not worth living, then although you can feel under certain situations, but if this continues and you are at risk of harming yourself, certainly that's when that is the time when even I mean anybody who feels this should seek help. We are not saying that it is okay to remain not okay all the time. We are not saying that. We are saying that when by saying that we are saying it's okay not to be okay all the time, but at the same time, we also would like to emphasize that if this not okay feeling persists for a long time and it affects your day-to-day living and you are feeling suicidal, then certainly it is not right to continue to feel this way. You need help, and you need to show that there are things that are actually going okay in your life. There are things that you have succeeded in life, because a lot of the times when we start feeling very depressed, we start seeing ourselves as very negative, as being failures in our lives, and we stop looking at all those things that we have achieved. I'll just finish by saying a few things about this pandemic, because everybody's mental health has been to some extent been affected by the pandemic, because life is very different right now. People are calling it the new normal. I'm calling it the new abnormal, because there is nothing normal here. And I would not like this to become normal. Certainly, where we are not being able to socialize with people, we are not going to be able to go out and sort of have a cup of tea or coffee in a cafe without feeling anxious. So till such times, we are going through difficult times. There are people who have been affected by corona in their family. There have been deaths. So I think my advice to you is, yes, we are all feeling not okay. But in that situation, since we don't know how long this is going to carry on for, it makes a lot of sense to establish contact, at least with one person in your life who will not give you things like montake shokto koro, or I mean, say things that does not validate your sadness or does not validate your feelings. There are people who will give you a lot of gyan, what is written in the Gita, what is written in the Upanishads, what is written. Yes, they are very, very valuable messages that have been given in all the scriptures. But sometimes you just need somebody to say, it's all right. It's all right to feel not okay. So I will end here and let my other speakers go on with what they have to say. Thank you for a patient hearing.
Thank you, ma'am.
Anoma, hello, Anoma. Before you carry on further, this is just for everybody, because I know personally Dr. Mukherjee will have to leave today because she has another webinar to attend at 6 o'clock. So I know that. Otherwise, I know she would have stayed and she would have listened to all of us. But incidentally, today that's not possible. So we'll have to bear with that. Yeah, Anoma, carry on, please.
Thank you, ma'am, for your valuable talk. Now I would move on to our next delegate, Ms. Debolina Dutt Mukherjee. Ms. Debolina Dutt Mukherjee is an Indian film actress known for her works predominantly in Bengali cinema and television. She did her higher studies from Loreto College and the University of Calcutta. She made her acting debut as a child artist with the film Manush Amanush. In 2014, she received critical reception for her role as a water prostitute in Tan. She played versatile roles in various cinemas like Ekla Akash, Chotushkon, Onubroto Bhalo Acho, and many more. She can be seen in various short films like Shopoka and in several televisions like Durga, Ekhane Akash Neel, Neel Shimana, Kobe Je Kothay, Protibimbo, Shatkahun, and the list goes on. Ma'am, we are overwhelmed to receive you here in this platform. All yours.
Thank you, Anuma. First of all, please let me know, am I clearly audible?
Yes, ma'am, you're clearly audible to us.
Okay, good. It's a great honor to be a speaker amongst such eminent speakers whom I'm sharing the platform with. And this particular subject, quote unquote, depression, is very close to my heart because I've been through it. And everything that I'm going to talk about today is going to be my personal first-hand experience. I'm not a doctor, and I'm not going to speak on the basis of what I have seen, what I have heard, I'm going to speak on the basis of my first-hand experience. And there are two doctors already present in this platform whom I have visited in my bad times. One is Rimadi and one is Subarnadi. And Anuma, I would like to request you another thing, that I'm sure each of us have a certain amount of time for speaking. So would you just give me an indication when I'm supposed to round up, right? Would you please do that? That will be lovely.
Yeah, sure, ma'am.
Just a second, Debolina and Anuma both. I mean, I would rather request Anuma not to stop the Bolina midway. People have heard me a number of times. So even, I mean, we have 15 minutes each, but even if I have to give away 10 minutes from my 15 minutes, I'm perfectly okay, because I want people to hear her. So don't stop her. That's my request.
Thank you so much. Okay, so what we are talking about today is it's okay not to be okay. Now, what I feel is that why is it okay not to be okay? If people who are hearing us, if you have a question in your mind that not okay is not okay, then why is it supposed to be okay? What I personally feel is that it is supposed to be okay, because when even if you are not okay, you certainly will be okay in some time. You know why? Because change is the only constant in life that I have seen, and it's an universal truth that nobody can change. That change is the only constant in life. Therefore, if you are not okay right now, even if you try your best, you cannot remain not okay for the rest of your life. So there is no need to think that I'm not okay, so it is such a big deal. Oh my God, what am I supposed to do? It's the end of my life. No, you will be okay. Similarly, it is okay to be not okay, because even if you're okay, it cannot be like this that you're going to be okay and happy and merry for the rest of your life. Because again, change is the only constant. There has to be times when you will be not okay, because it's life. As long as you're alive, there will be times when you will be not okay. If you are never not okay, if you are always okay, if you have no pain, if you have no problem, no negative feelings in life, then you are not really properly alive, you know. So it's actually not only okay to be not, I would say it's great to be not okay. Now, am I sounding a little over the top? And then let me share my experience. When I have been through acute depression. I don't know what level or what stage of depression medically I should call it, but Rimadi knows and Shubarnadi knows, because I have personally visited them when I went through this. For the first time, when I had my depression attack, I would say attack, I was not okay to the extent of, I would start with the extreme feeling that I was affected with, and that was, I used to wake up every day in the morning, and the moment I used to open my eyes, I used to call my mother and say that, is there any kind of injection that can be applied on me which can make me go back to sleep? It is impossible to stay awake. The pain uh, that I was going through was so acute that it was difficult to stay awake. And naturally, if you wake up every morning and you feel like applying an injection on you that would make you go back to sleep, is an amount of pain that would eventually make you feel that it is unbearable and there is no point in living if you are going through this kind of pain. Now, in spite of that, I was the first that, and this that I talked. I had stopped eating. I was unable to eat anything. I never felt hungry. Nothing made me happy. I never wanted to watch films. Acting is my passion, and luckily, that's my bread and butter too. I never wanted to go to my shoots. I never enjoyed company. I never wanted to talk to anybody. Everything around me seemed dark and completely hazy. So my condition was that bad. But the first mistake that I made, which I would like to convey to everybody, because I have seen people around me making this exactly the same mistake whenever they are going through depression. That is, I thought that I am just depressed or upset. That's what I thought. Or it's a bad feeling that I'm going through, that it's just a passing phase, it'll pass by. Which is true. It will pass by. You can be upset, you can be just depressed, you can be just feeling bad, which you will will be able to overcome. But at times you get into, quote unquote, what is called medical depression, you, which for which you need to see a doctor. And besides saying it's okay not to be okay, I would like to add another tag to today's discussion, which is so important, is it is okay to see a doctor if you are not feeling mentally okay, which is still a taboo in our society. I have to say this because I see this all the time around me. People having notions with, if you are going to see a doctor because you're feeling depressed or upset or frustrated or not being able to handle your mental condition, that you are mad and you are going to a pagole doctor, quote unquote. A psychiatrist or a psychologist absolutely does not mean pagole doctor. It means somebody who can help you with your mental health. You know, mental health is much more important than physical health. That is something that we have to be very clear with, right? If our mental health is fine, then we can overcome, we can fight, we can handle any kind of major physical health very nicely. But if we are mentally not okay, we, any kind of physical problem would deteriorate very easily, just because we are not mentally okay. Because everything, every indication, every state of our body, every state of our mind, every state of our body, I would rather say, initiates from here. Glands are secreted from here, things are initiated from here. It's inside the head, it's inside this part, যেটাকে আমরা সবসময় বলি, we relate it to পাগলামো, পাগল. Now please, first of all, everybody get out of this notion that depression and seeing a doctor, a psychiatrist or a psychologist has got to do something with madness. Though madness is also fine, it's also a state of mind. One can be mad and one can be treated, that's also fine. But this itself doesn't mean madness, and a psychiatrist or a psychologist cannot be a taboo. You have to be very open to this. So I made the first mistake, not because I had taboo. I thought that if it's a mental problem, I'm going to deal it myself and I'm going to be fine, I'm going to be okay. But whenever it's a physical problem, if you are having a fever also for 3 days, then we see a doctor, or we at least call a doctor, or we at least consult a doctor. But I was suffering from this major depression for say about 2 months, and I didn't see a doctor. And then I had a dear friend of mine, I still have, who happens to be the closest friend of mine, called Sudeshna Ganguly. She suggested me that, Debulina, you need to see a doctor for this. This is not something that you can handle yourself, and you'll really be fine. And this particular suggestion of hers made me see a doctor for the first time. And trust me, I had medicines for about a year, but I started feeling okay after I saw a doctor. I've not seen one doctor. First of all, let me make this very clear. I have not seen one doctor. I have seen 3 to 4 doctors. As far as psychiatrists are concerned, I have seen, as far as psychologist is concerned, I have seen only Shubarnadi. So I was very, and why did I do that? Because I was very anxious. I wanted to know that what is happening to me. Everything around me is fine, everything around me is normal. I am trying to involve myself into normal activities, but in spite of that, why is everything around me so gloomy, so dark, and so cloudy all the time? And why do I feel like crying all the time without a reason? And this is also a very common symptom that people who are going through depression would face, that you go through crying spells, which I used to go through. You start crying and it goes on, you can't stop, you just can't stop, and you don't know why you can't stop, you go on crying. Now all these things are terrible. Now when I went to a doctor, and I went to doctors, and I started discussing about this, I started discovering this, I realized that this is a physical disease, because it is happening due to certain excessive secretion of glands or under secretion of glands, but it's related to secretion of glands, which can be cured by medicines. And it is as simple as any other disease. And you have medicines, like when, for example, you are suffering from typhoid and you are having fever due to that. All right. Now, a doctor gives you medicine for typhoid, which is the main disease, and the doctor also gives you paracetamol or Crocin or something like that for the fever to come down immediately. All right. Similarly, I was also given two kinds of medicines, one to immediately feel better, the immediate gloominess that I was going through, to immediately feel better, which I would compare to the fever part. And the other was a long course of medicines, which I would compare it to antibiotics, which is given. For example, I would compare it to the typhoid part to cure the main root cause of the disease. It can be depression, it can be bipolar, it can be schizophrenia, it can be anything. I was going through clinical depression. That is what was told to me by the doctors I had visited. All right, so I was giving these two kinds of medicines, and by the end of the third week of me having medicines, I started feeling magically and unbelievably better. Like my condition was so bad that I was confirmed before going to a doctor that nothing can make me feel better, because that is the feeling that you go through when you go through acute depression. You feel that you're never going to be okay. But the moment I started having medicines, first week was a little better, second week was a little more better, and by the third week, I was so confident that I'm going to be cured completely. I just knew that I'm going to be cured completely. And today I'm sitting here after the full course of treatment, of medicines, and also sessions that I went through with Subarnadi, that I can talk so subjectively about this topic without at all getting affected. And I'm doing so good. I'm absolutely fine. I'm doing so well. Now, that just does that mean that I am never going to be affected with depression again? Or I will never have a depression attack again? No, absolutely not. It is absolutely possible for me to get into depression again, to have an attack again, to have an attack again and again and again for the rest of my life, because there can be triggers. How many times in life you don't know? And life is all about having triggers. If you are alive, if you are going through life, you will be having triggers, because life is not easy. But now, if I get into a depression attack, I would not be as nervous or anxious or negative or feel like there's life is not worth living, because I know it's simple. It's a disease. You can be cured, and it is so normal to go through depression, quote unquote, the disease, and it is so normal, and it is so essential the moment you feel like that to see a doctor and feel okay about it. Now, I have seen people having this notion also that drugs that are given for depression are drugs that is supposed to make you extremely unwell. In what sense? Because if you are having antidepressants, you are supposed to be feeling sleepy all the time. Antidepressants means they make you fall asleep, and that's all that they do. That is a notion that most of the people who've not seen a doctor and who've not ever had antidepressants feel about it. Now, that is again one feeling that is completely and totally wrong. If you are going through a kind of mental problem or a pain for which you are not being able to sleep, and sleep has become a crisis in your life, and you have shared it with your doctor, then definitely the doctor will give you medicines for a certain amount of time that will help you to sleep. But that's a different issue. But the medicines that are given to treat your depression, to treat your this particular feeling of feeling not okay, is never associated with sleep. And how am I saying this? I'm saying this on the basis of my first hand experience, so you've got to believe me. Because when I started having my medicines, before medicines, I never used to sleep properly, and I never used to feel okay. The only difference that happened after having my medicines is that the sleeping part was peaceful and okay, but it was the same 6 to 8 hours of sleep at night, and the rest of the day became much more energetic for me, and I became all the more awake. I never used to feel like going to work. I never used to feel like talking to anybody. I used to lock up myself in a room. I never wanted lights. I wanted lights to be off. But I started feeling more and more awake. I woke wide up. And previously, after waking up, I used to feel that I should go back to sleep again. And this, after having medicines, after just a week of medicines, I started feeling that after waking up, I started feeling that, wow, the morning is good and I should go to work. And I used to feel like going to work. So, it's just the opposite of what you think. Depressants equal to sleep? No. It is equal to more energy and more life and happiness, I would say also. So this is something that you need to be clear. You don't need to be scared about depression and about doctors, that is psychiatrists and psychologists. Number one, very important. Number two, you absolutely don't need to be scared about medicines that are given to you by psychiatrists, thinking that it's going to do some kind of permanent damage to you, which is absolutely not true. Because you can see me, doesn't seem like I have been damaged in any way. I can assure you I have been not. I'm taking responsibility when I'm saying this. And number three is that the first feeling that you go through when you experience this particular feeling of depression for the first time, the first feeling that you have is, if it's acute, that I am never going to be okay again, which is something which is not in your hands. Because even if you don't want, you will be okay again, because change is the only constant. Your mental state cannot remain the same all the time. And I repeat again, it is just because of this. Again, if you are living a very happy-go-lucky life, you are very satisfied with your life, you are experiencing the pink of your health right now, that is also not going to last forever in a similar manner, because that's not what life is all about, and that's not normal also. It is very normal to go through crisis. It is very normal to fall sick. It is very normal to feel depressed, to feel frustrated, to feel anxious. It is also okay to feel suicidal, all right? Because when a person feels suicidal, there is no reason why you should feel guilty about it. Whereas, I'm feeling suicidal. Am I mad? I'm feeling suicidal. Oh my God, should I feel very guilty about it? What's going to happen to me? I'm feeling suicidal. There's nothing to panic, because you are feeling suicidal because there are certain reasons behind it. There are certain triggers about it. It's not your hobby to feel suicidal. You are not liking the feeling at all. And everybody understands that. Trust me. And if you are going through a situation where you don't have people to understand that, people around you don't understand that, it's very important, first of all, it's very important to have people around you to talk to when you are going through depression. If you don't have people around you who would understand that, or if you have people around you who would think that you are mad if you are going through such feelings, that is the time exactly when you need to see a doctor. Because doctor would always understand what you're going through, and a doctor would consider you to be a very, very normal person. And the best part is what? The moment you see a doctor, you're just going to be fine, after a few days. So the last very important 2 points I'm trying to round up as fast as possible. The last very 2 important points, which I would say are very important, is that the moment you start going through that kind of feeling, and there can never be a confusion, whether am I depressed or am I not depressed? Am I going through depression or I'm not going to depression? আমি না ঠিক বুঝতে পারছি, মনে হচ্ছে আমার ডিপ্রেস লাগছে, কিন্তু আমি এরকম হয় না। It is such a medical depression I'm talking about. It is such a terrible feeling, and it makes you feel so horrible that you will know that something is wrong with you. You will know that something is wrong with me. I'm not okay. Which is there in the tagline, not okay. This not okay thing is going to bug you all the time, and you will know that something is not okay with you. The moment you feel like this, You have to and have to and have to talk to somebody about it, and there's no negotiation about it. You cannot negotiate this part of the treatment, that you have to. You don't come up with things like, I don't have anybody to talk to. If you don't have anybody to talk to, not a family member, not a friend, not a boyfriend, not a girlfriend, not a colleague in your workplace, then you have a doctor to talk to. So you always have somebody to talk to. So point number one, you need to talk to somebody. And point number two, it is absolutely fantastic to seek treatment and go to a doctor, because it is just a disease like any other disease. And trust me, it is so easily curable, only if you know that it is curable and you believe that is curable and you seek help. So it is absolutely okay to be not okay, because it's not such a big deal, and it is absolutely curable. And everybody goes through this, trust me. Even the person whom you look up to all the time, thinking that, wow, this person is so happy all the time, this person is never sad, never depressed, why can't I be like that person? Remember that you've not walked his or her life, you've not stepped into the shoes of that person. So that person might have been depressed and frustrated also sometime or the other, which you don't know. So it's absolutely okay. That's all I would like to say about this.
Thank you, ma'am.
Did I take a lot of time?
No, not at all. You were on exact time. Thank you so much. Now, without delaying, I would move on to our next speaker, Dr. Subarna Sen. Dr. Subarna Sen has completed her PhD in applied psychology from University of Calcutta. She has 30 years of teaching and administrative experience, and is presently working as a guest faculty in various institutions of Kolkata like Indian Institute of Foreign Trade, IIFT, United World, and many other eminent organizations. Dr. Sen has participated in various seminars and workshops as a speaker across the country, including institutions like NIMHANS Bangalore. She conducts training programs for various institutions and corporates across the country. She lends her services as a consulting psychologist and is the secretary of Eastern Zonal Psychological Association. She is presently a director of Manav Zameen Foundation. Over to you, ma'am.
Thank you, Anoma. Thank you, Debolina. I'm really, when I heard your video, I really wanted you to speak, and I'm happy that I did the right thing. Today also, when I heard you, I was really very happy. And see, she has shared and expressed her views, and she has shared her own experience, which is very important, because what happens is, when professionals say, many a times what happens is people think that, oh, they are saying, they are talking big, it's all theoretical, which is quite natural. I'm not even blaming them. It's quite natural for people to think likewise, that they are talking theoretical, they're speaking theoretical, talking big, right? What Rimadi mentioned, I would also like to mention that, see, even before being psychologists or psychiatrists or anyone, mental health professionals, primarily we are human beings. Firstly, we are human beings. I was not born a psychologist. I was not born a mother. This I tell my daughter as well. I was neither born a mother. I was neither born a wife, I was not born anything else other than being an individual. So we are all basically human beings. And we do share our own concerns with our own selves. And I do call up Rimadi when I need to. She calls me up when she needs to. I do call up many of my friends. Onoma, Atri, they all are there. Not junior to me, but that doesn't make any difference. So mental health professionals also need mental health. They also need mental health help, and there's nothing wrong about it. Now, when we named it as it's okay to be depressed, I always keep saying this thing, that it's okay to be depressed. And then I add the next part of the sentence, but it's not okay to stay depressed. It's absolutely okay to be depressed, but it's not okay to stay depressed. As Debolina very rightly pointed out, that even if you think, that was a very nice point, even if you think that you actually don't have anybody to talk to, go to a mental health professional. At least you have somebody to talk to. And now people might also say that when we approach mental health professionals, there are issues of money. There are many issues all the time. But trust me, despite all those issues, there are people who, whatever otherwise their charges might be, when they see that people are in distress and they cannot afford, yes, we do not do it for free, but we do consider. I can tell it confidently that we do it. So it's not that there is nobody. Devalina very correctly mentioned it, pointed it out, that there is always a professional. And apart from a professional, if you really want to reach out somebody, your friends, any of the family members or anybody, maybe you'll have to figure out who the person could be. But even then, you might find out somebody. And if you don't, of course, we all are always there. Now, Debolina shared her own experience. Srimati spoke a little about why it's okay not to be okay and all. Let me delve a little into the clinical part of it. Now, when I'm saying clinical part, I'll just take, I know the time limitations because we prepared the schedule accordingly. So I'll just mention a couple of reasons why people might get depressed, and then a couple of symptoms which can make you identify when you or anybody close to you is feeling depressed or they are feeling depressed. And then at that point in time, say as a first aid, I mean, a couple of Devolina's points I really liked when she compared the entire thing with this antibiotic and the crocinocalpol thing, one to, I mean, pull the fever down and the other as an antibiotic. True, there are different ways of doing things. So just like as a first aid, how to primarily give some comfort, not console, please. Certain words are very, very important when we are dealing with depression. Not console, comfort, some amount of comfort to the people. When primarily, see, when we're talking about depression, depression is a stage clinically when it's chronic and acute both. Like when you're feeling bad for one day, you're feeling sad for one day. Sadness is not depression. As Devalina time and again mentioned, that it's when she's talking about clinical depression. We all are talking about clinical depression. So it's not just sadness. It's not at all mere sadness. It's something far, far more grave than that. So when you're feeling not okay for quite over a period of time, and when it's getting acute to the extent that it is affecting or impairing your day-to-day activity, your functionality is getting impaired, that means you're depressed. That means it's not right. That means you need to consult a professional. Your functionality is getting affected. You're not being able to do, like she said that she didn't want to do anything. She didn't want to do any work. She didn't want to go anywhere. That is the time when you actually need to understand that your functionality is getting impaired. So when your functionality is getting impaired, it's definitely depression. Why it might happen? One major point, there's no comfort zone with anybody around you. It might happen. It might sound very ridiculous, very weird that how can it so happen that there's no comfort zone with anybody? It can happen. Why? Because if you don't share your values with people, you will not be sure whether people will understand what you are trying to say. So that is where you might feel uncomfortable sharing your concerns with others. Point one. Point two, you are scared of people being judgmental. And this is something which is very, very true, because this is something which has happened. I will definitely not name. One young girl, she used to come to my chamber. First day she came and told me, I don't know what to say, but I've come on my own. I have a lot to say. I don't know how to begin. Okay, fine. Then I dealt with her for day one, day two. Day three, she came, sat down and told me, Madam, I want to tell you something. I'm a lesbian. I said, okay. And then she looked at me and said, you wouldn't say anything? I said, what would I say and why? Whether you will be a homosexual or heterosexual, that's your sexual orientation, that's your choice. So, I mean, why should I say something and who am I to say something? And then she opened up that before me, she had been to consult somebody, might not be a psychologist, whoever. And the moment she said, on day one, she said that I am a lesbian. And the first response to that was, what? The moment somebody responds that way, what? With a question mark, the door is shut forever. The door is absolutely shut and shut forever. So the moment you think that people might be judgmental, you will not be able to share it with anyone. Depression can take place out of many reasons. One, a very major reason, especially for students, a major disparity between your aspiration and your achievement. Pressure, societal pressure, parental pressure, peer pressure, rejection, because many people today, in pursuit of trying to be positive, we are going wrong in one particular aspect of life. That is, when we are teaching our children or our students, we are trying to motivate them all the time, and all that we keep on telling them is try, you'll be able to do. Try, you'll be able to do. We need to add one more thing after that semicolon. Even if you don't, it's okay. Even if you don't, there's a next time. Even if you don't, that's not the end of life. Because we don't tell them this part, what happens is they start feeling so bad that they cannot accept rejection. And that might lead them to depression as well. Abuse. This abuse can be physical, emotional, mental. Now, there's a difference between mental and physical, emotional abuse. That is, mental abuse is when you're being, when you're being bullied, you're being made sarcastic comments at. These are all mental abuse. Emotional abuse might not be that. Very funny. Out of too much of love and expectations, there can be emotional abuse. Emotional blackmailing is sort of an emotional abuse. Like, suppose your parents never tell you that you have to do good in life, but they keep telling you, we know you'll do good in life. That's a huge, huge pressure. Trust me, and that is an emotional abuse. Because as a parent, as a mother, maybe I'm not understanding if I'm telling it to my daughter, but she's taking it up as a pressure. So we have to be very, very careful about what we are saying whenever we are talking to people. Separation anxiety is another thing which can make you feel depressed. There are people who really cannot accept separation, any sort of separation. People who have gone through separations, maybe in childhood, maybe in later stages of life, they are more susceptible to depression. What are the symptoms? First major symptom probably is withdrawal. Withdrawal from life, withdrawal from everything, and withdrawal from all activities which otherwise people loved to do. Like again, I'll take her example. When Devolina was telling that she did not feel like doing anything. She's a fantastic, apart from being an actress, she's a fantastic dancer. I'm sure at that point in time, probably primarily she didn't even feel like dancing. People don't feel like doing anything that they otherwise like. So a total withdrawal, and that withdrawal leads to a change in your social pattern of life. It brings in changes in indecision, mood swings, lots and lots of mood swings, forgetfulness, all the time, most of the time being restless, and crying for apparently no reason is a very, very major thing. I'm sitting down, tears are rolling down my cheeks. I myself am not clear about why I'm crying. Okay. Don't always try to dig into the reason and try to find out why am I crying? Why am I crying? We actually, we expect a little too much from ourselves. Nimadi was also mentioning that we always think that we have to be all right all the time. No, we are not robots. We are human beings. We don't have to be, politically correct, or we don't have to be all the time. We don't have to be okay. No. So even if I feel like I'm crying and I cannot find out the reason, it's okay. I'm allowed to cry. I can afford to cry. I'm a human being. And if I'm a sensitive human being, pretty many things which are happening in this world will make me cry. And we should be okay with that. We have to be okay with that. Crying is not a weakness. On the contrary, crying takes a lot of courage. It takes a lot of courage for us, for anybody to cry. Because crying means you're accepting that at that point in time, you are weak. To accept that weakness takes a lot of courage. So crying is also perfectly okay. Then there are sleep disturbances, which can make you understand that you're depressed. Then taking on substance abuse, increased use of alcohol. Alcohol is okay. If you love to drink and you drink, it's perfectly okay. But when the drink starts drinking you, that's not okay. So taking refuge of the drink, that is absolutely not okay. Getting aggressed a little too much. Maybe people who are otherwise not that angry type, quote unquote angry type. I'm a very aggressive and angry type of person. People who are otherwise not. So having said this, when I say that I'm a very angry type of a person, if I scream, people take it very casually. Everybody in my house, they take it very casually. She screams, she's screaming, it's okay. But somebody else who doesn't scream, say my husband, who's a very quiet kind of a person, if he screams, then I would start thinking, what's wrong? Something is definitely wrong. Otherwise, he's not the person to scream. Similarly, when you find people who otherwise don't scream, who otherwise don't get irritated, don't get aggressive so much, when you find that they're doing that, please try to figure out whether there's something is going wrong with that person. Now, coming to how to deal with it, in a very short time, we have to cover it up. So, how to deal with it? One, as Rimaji said, Dabulina said, medication. Yes, there's nothing wrong in medication. And get rid of those disgusting 18th century ideas that psychiatric drugs make you feel dependent on them, etc., etc., etc. Nonsense, absolute nonsense. There's nothing wrong in medication. There's nothing wrong in therapy. Going to a psychologist does not mean if you're crazy. People who feel that going to a psychologist means that you're crazy, ask them to get educated once again. They need a re-education. Starting from KG1, they actually need it. And primarily, as a first aid, what you can do? Offer support. Now, how do you offer support? Be gentle, but be persistent. And please don't push. Tell me what happened, tell me what happened, tell me what happened. Tell me, you tell me and you'll feel better. You tell me, you'll feel better. Trust me, at that point in time, the person feels like slapping you right, left, and center. Because that's a time when the person does not feel like speaking. You have to understand that at that point in time, the person does not feel like speaking. So don't push the person. Then what are you supposed to do? Be there. Be there, but don't make it very loud. I'm there for you. Whenever you feel like, you can talk to me. Come on, I'm there. Okay, don't cry. I'm there. No, don't make it so loud. If you are there, trust me, that will speak. You won't have to tell him or her that you are there, or anybody. You don't have to tell the person that you are there. If you're there, it will speak. It will show. It will automatically show. So be there with the person. Point one. Be unconditional, be non-judgmental. If you need to talk, when the person starts opening up, when the person speaks, be unconditional, be non-judgmental. Don't lecture. Listen without lecturing, and also, if possible, even without suggesting. Don't start jumping into suggestions, offering suggestions right at that moment. No. Primarily, just patiently listen the person out. That is of utmost importance. And even when you start talking, when you start empathizing with the person, empathize, don't sympathize. Don't say like, yeah, I understand things have been so bad. No. That makes you stand in an elevated level, and the person feels that you're pitying the person. Nobody likes pity. Even a depressed person does not like pity. So don't put it across that way. Don't ever say that, okay, this has happened. It happens with everybody and it will be okay. True. What you're saying is send person right. It has happened with everybody and it will be okay. But that is not the time to tell it to that person. Because that, according to that person, that would be demeaning that person's feelings and emotions. Don't ever demean anybody's hurt, anybody's feelings or emotions. Don't at all ever do that. You have to rather validate their feelings. I understand. The phrase that actually makes a difference is I understand. I can understand what you're going through. Yeah, at times when the person starts opening up, you can share your own, you can relate it to your own self and share your own experiences. That would rather make the person feel better. Not as Rimadi was telling GANs, not the lectures, not at all. And the last thing which you need to keep in mind is that when you are telling the person that you are there, you have to be patient enough not to breathe on the person's shoulders. Continuously, if you go on telling the person, are you okay? You go out, 5 minutes later, you come back, are you okay? That is, vigilance. That's not being there. That's just vigilance to ensure that the person is not being suicidal. Fine, that's okay. But that vigilance is not what the person needs. What the person needs is empathy. Just be there. For the first half an hour, 1 hour, maybe 2 hours, maybe for the first day. Just be there, sit beside the person. Be there. Make the person understand that you are there. At the most, all that you can say is, I'm there. If you want to talk, it's okay. But then after that, don't start pushing. We want to talk. We want to talk. If the person wants to talk, he or she will. That's important. So again, as I started with, I'll end with that. It's okay to be depressed. It's not okay to stay depressed. Thank you so much.
Thank you. Thank you so much. Thank you to all our three speakers for giving their time to us. Now I would like to pass on to Ms. Anesha Shin.
Thank you, Anuma. Thank you all of you for sharing your insights about the topic. Now I would request Mr. Dipankar Shin to give the vote of thanks.
Ladies and gentlemen, a very good evening to all of you. It gives me an immense pleasure to deliver the vote of thanks to our speakers who honored this webinar with their enlightening and inspirational thoughts. I would have also like to thank all the YouTube viewers for being with us throughout this webinar and sharing their comments in this chat section. And I convey my congratulations, heartiest congratulations, and and gratitude to all of my team members of Manav Zameen Foundation, our Psycomm Education initiative. Thank you all. Stay safe, stay at home.
Thank you again. Before we wind up, I would like to inform you that the feedback link for today's webinar is shared in the YouTube chat box. Kindly subscribe our YouTube channel. Write to us at manavzameen@gmail.com or on our web Facebook page, that is Manav Zameen Foundation. The registered participants shall receive their certificates within the next 10 days. Let me also take the opportunity to inform you that Manav Zameen Foundation is going to organize a workshop on inattention, dealing with attention problems in children of 3 to 6 years on 28th August from 3 p.m. to 6 p.m. The workshop will be for guardians, children, teachers, counselors, and special educators. For more detail, please visit our Facebook page or write us to our email address. You can also find us at www.manavzameen.com. That's our website. Good night, everyone. See you sometime soon.